the book Forces of Habit. We learned about the history of drugs as well as the specific drugs that ultimately started our global economy. In Drug Dealer MD, the last book of this course, we are presented with facts and stories surrounding a very sad, very real prescription drug epidemic. Anna Lemke did a fantastic job writing this book. The stories and factual information that were intertwined throughout the book's entirety made the read easy and engaging. On page 2 in Forces of Habit, Courtwright states, in regard to drugs, none is inherently evil. All can be abused. All are sources of profit. All have become, or at least have the potential to become, global commodities. On page 14 of Drug Dealer MD, Lemke discusses the 3 C's of drug abuse and addiction: control, compulsion, and consequence. In this context, control refers to out of control use of a particular substance. Compulsion refers to spending a great deal of time, energy, and mental real estate on obtaining, using, and recovering from the use of a particular substance. And consequence refers to the social, legal, economic, interpersonal, and moral or spiritual repercussions of continuing to use the substance. Then on page 26, Lemke states, prescription drugs now rank 4th among the most misused substance in America behind alcohol, tobacco, and marijuana, and they rank 2nd among teens. What is happening? Our population is being controlled by who? Global elites. These elites quickly discovered that they could use drugs to control manual laborers and exploit indigents. Opium, for instance, kept Chinese laborers in a state of debt and dependency. Alcohol induced native people to trade their furs, sell their captives into slavery, and negotiate away their lands. When did this madness begin? The global capitalist mindset emerged in the late 1900s, which we learned in this book. On page 121 of Drug Dealer MD, lots of books. The pressure to see more patients per unit time and to bill more per patient pervades all of medicine, encouraging doctors to continue to prescribe drugs. The pressure to get patients in and out quickly can be overwhelming. Why are we being controlled? They control us and keep us in a state of debt and dependency, so we continue to work and build the global elite's dreams instead of our own. The population keeps the momentum wheel going, making the rich richer and keeping the poor poor. Yowza. How are we being controlled? By a system of control built on drugs. If they don't get us hooked on one drug, they have many others that they are advertising or pushing in our face on a daily basis. In the prologue on page 3 of Drug Dealer MD, Lemke shares a story about a patient of hers that is making a loud scene at the hospital because she needs her medication and is clearly addicted to opioids. I know I'm addicted, doc, but if you don't give me the pills I want, I'll sue you for leaving me in pain. I realized that I and my fellow healthcare providers had become trapped in a system gone mad. We were unable to deny this obviously addicted patient more opioid painkillers, even when we were well aware of the harm these medications were causing her. She then goes on to say that the same patient came back a month later with the same end results. The compulsion aspect of this control system is shown here as the patient lives her life around this drug, leaving her no time for personal development, furthering her education, or time for intellectual thinking. And what happens because of this? The consequences range, but one that stands out over the rest is lack of social engagement. Thus, the cycle continues, leaving our population unhealthy, depressed, unloved, angry, unaware, and extremely unsocial. Everyone has a hole or a void that they are trying to fill. Instead of taking the proper steps and doing the right thing to overcome the emptiness, the new normal is to fill that void with a substance, creating substance abuse, addiction, and in some cases death. So what are we doing to break the cycle of abuse and control? Do we slowly start to wean ourselves off of caffeine, alcohol, any medication we may be taking? The elites clearly know something we don't, and they live their lives differently than the rest of us do. My intellectual promiscuity is directed at the fact that many of these global elites live long-ass lives. So again, how do we get the good stuff that they are taking to live these extravagant, relaxing, long lives?